Thanks, Cara. And just a huge thanks to Cara for creating such a great kind of seamless panel that we've got. We're going to all have a chat later. So, yeah, I came to drug policy from being a teenager and being absolutely baffled by the fact, so I don't have any slides. I've been absolutely baffled by the fact that our drug laws aren't structured around harm, so that they're not in the best interests of individuals, and they are basically around the profits of the big tobacco and alcohol companies. And it's seen as kind of too political to challenge that. So I realised at quite a young age that our government does not have the best interests around people's health and well-being at its centre, and that it's all to do with kind of corporate profits and politically driven. So that's kind of what was my political awakening, as well as drugs being the main reason why I started to think politically. I've got a background in the NHS and public health, so I'm very public health and harm reduction focused, so I obviously bring that to everything I do, and obviously seeing the huge harms around our drug laws explained by Steve previously, and I just think I'm hugely motivated by injustice, and I'm going to talk a lot about policing and the over-policing of black communities, obviously being in London with a huge issue around the Metropolitan Police. I'm just really motivated for us to all collectively work together to address these injustices around people's drug use. I'm also going to cover a bit about the Green Party's drug policy, what that is, how we came to work on it and what we do with it now, and then also my work on the London Assembly, and I'll talk a bit about what the London Assembly is, because I appreciate that it's not widely known. So the Green Party's drug policy, just to note, is for England and Wales. Green Party of Scotland and also European Green Parties are different parties, although we share some kind of similar values and similar philosophies. The Green Party of England and Wales is a distinct party. And we are incredibly democratic and driven from the grassroots up, where we know a lot of this change happens, which I think is really exciting, being part of these spaces where you hear people really working on what people need, and this is where kind of change happens. So historically, the Green Party's drug policy just focused on cannabis. And I think that is a bit of a stereotype of the Green Party, that we kind of are associated with cannabis use and kind of, more just, that's kind of, there's many stereotypes of the Green Party, but that's one of them. And so a friend and I were door knocking back in 2018 in Dalston, where I'm now a councillor, but he was trying to get elected in 2018, and he really wanted to talk to people on the doorstep about the injustice around drug laws and how we want to treat all drug users with compassion, but we couldn't because our policy didn't represent that. So he and I decided to rewrite the drug policy for the Green Party, took it to conference, and got the kind of nod from conference to work on it. And people put us in touch with people like Transform and Release, and Anyone's Child, which is an incredible organisation that Cara is part of, around families who've been infected by our drug laws, either by losing family members or seeing them being incarcerated and imprisoned, who work for drug reform. So their voices were very much at the heart of how we developed our policy. We also spoke to groups representing men who have sex with men and chemsex and all different types of drug use. And it honestly was one of the most exciting parts of my life, writing the Green Party's drug policy, because we sat around a table and devised what the world could look like. And I think when you have these conversations and put it into reality, you really start to realise that these things are possible. So we had some great chats, and we also joked about some of the headlines that might come out from our policy once it was developed. One of them we joked about was someone said, we're going to have a headline saying Green Party want to legalise cocaine, and someone went, free trade cocaine, which I thought was hilarious. Because our policy is absolutely rooted in not just the harms that Steve was describing and the harm reduction that Shobha was speaking to. It's all about legally regulating all drugs and doing that within the different kind of different frameworks that Steve was talking to. So from licensed venues all the way up to GPs and kind of pharmacies. But it's also rooted in that global responsibility. So we talk a lot about the trade and the supply and the use, and rooting it around taking the whole of drug use and drug trade out of the hands of organised crime and into those of health professionals. And just also the headline of our policy, it's literally like one of the first sentences is people use drugs, humans use drugs, they have always used drugs. And that's the frame of the Green Party's policy. And then, so we've split it into long-term and short-term because we wanted it to be hugely practical. So we do have the long-term policy, which is all about legally regulating and what a green government would do, or we hope any government would pick up our policy. We're not precious, so if any other parties want to legally regulate drugs, we'd be very happy for them to do that. But we also speak to, so that includes things like the importance of medical research, expunging criminal records. We'd also set up an advisory council, which would make sure, look at trends and just make sure that things were working the way they needed to, because obviously these things develop. But we've also got a short-term policy, which is all about what we could do now, so things that you could do within the framework that we've got, because as we've been hearing from Shoba's talk on harm reduction, when you do live within prohibition, the only things that we can do currently are push for change, but also work on harm reduction. So our short-term policy is really focused on that. So it talks a lot about education, but also supporting money for drug treatment, naloxone, which is reverses a heroin overdose, so making sure that as many people as possible know about that and are carrying it, particularly the police. So we call that our short-term policy, and that part of the policy enables our elected people to talk about it as part of elections, but also people like Cara and I working in elected positions to be able to work on that policy. So that's kind of what I'm going to speak to now in terms of how I use that policy in practice. I started quite big in my approach when I got elected last year onto the London Assembly. So the London Assembly is 25 people that are elected to hold the Mayor of London to account. We don't have any budgetary powers in the way that we exist. We can do budget amendments to his budgets. We can scrutinise him. Sadiq Khan, that's why I'm using him. I did run to be the Mayor of London, so I do hope that it will be someone else at some point. But he has a massive budget of about 32 billion. And our job is to make sure he's using that in the right way. But obviously he's got behind loads of different initiatives and does have a huge voice and a huge platform. So I've been trying to appeal to him in terms of being an advocate for drug policy and drug change, using examples from Europe, because I know that the UK is in quite far behind other countries in terms of the change that we need to see from legalization, but also the way we even kind of speak about drug users and taking that compassionate approach. And I think if the Mayor of London was talking about legalizing and regulating drugs, it would be transformative, which I have said to him, but he hasn't done so yet. I also use the policy to speak out when things are happening in the news. So obviously there's been a lot of noise around ketamine recently, and rightly so, given the harms that we're seeing around young people. But obviously the government's only talking about reclassifying it as a Class A drug. We know that they looked at that back in 2014 when there was a huge increase in harm around ketamine, and they moved it from a Class C to a B. Obviously that hasn't made much difference because we're still in the same situation again 10 or 11 years later, and I'm really just infuriated that the government has recognised that there's a kind of health problem around the use of ketamine in young people, but their only response is to look at a criminal and extending a prison sentence by looking to reclassify that drug into a Class A. Obviously, us as a Green Party would like to see that conversation opened out into regulation, looking at that pharmacy model or the models that Steve was speaking to. And I just think us being able to have our policy and to say that, it's agreed by our party, we're the only party in the UK with this kind of policy, to just, put forward that different perception, and so it doesn't just get closed down to looking at a kind of criminal approach. The role in the London Assembly is to challenge the Mayor, who's got a responsibility for the Transport for London, the fire brigade, but one of his main responsibilities is as the Police Crime Commissioner for London, which means that he's got the Metropolitan Police as one of his responsibilities, which I might refer to as the Met. So I have tried to challenge the whole frame around drug use within London. The Mayor of London does talk positively in some ways around drug use. He set up a drug commission in 2022 to look at cannabis, because obviously in London we have a huge problem around the disproportionate use of police powers on our black community, 5 to 6 times more likely to get stopped and searched if you're from the black community. But obviously we know the injustice doesn't stop there, that black communities are more likely to be charged and then charged with longer sentences. So that's from research from Release. So I just think I'm trying to challenge the whole frame around disproportionality. It's incredibly hard when we have quite a right-wing assembly, and often what I say is undercut by some of the Conservatives or even some of the Labour assembly members. I also have used moments where there's been, I don't know if people are aware, but in March there was a huge spike in overdoses in Camden. Thankfully, so there was 33 overdoses in Camden, all prevented from death. But I think that was a huge moment at the beginning of March that really spiked my concern in terms of the synthetic opioids within the supply, and also just how harmful drug use can be in our city. So I tried to use that as a moment to encourage the Mayor of London to push the Met Commissioner to make sure that people were the Met were carrying naloxone, but you just get kind of met with either, smoke screens and dodging, or, as me and Cara talk about, you kind of get sent around the houses when you're trying to influence and affect change. But I really think that having these discussions kind of shifts the Overton window. I think that even however many of us who start having these conversations and put forward different perspectives, if I wasn't in the Assembly, I don't think any of this stuff would be spoken about. I don't think those people experiencing those overdoses would have been mentioned. And I think the Mayor of London should be aware of this, and there should be those voices and experiences that need to be spoken about at that level. I also reflected to him the increases in drug deaths in the city. So obviously the data is put out by the ONS every year, and drug deaths in the city have gone up every year since 2012. We had 500 drug deaths in 2023. And again, this is something that I don't think would have been spoken about if the Greens weren't there, kind of bringing those experiences and that, raising that alarm as a public health emergency. So that does, mean that we need to kind of really work on harm reduction. I've created a bit of a network with different councillors across the country who are really working on harm reduction. You might know about the Thistle in Glasgow, the drug consumption room. There's 200 drug consumption rooms globally. These are obviously places where people are able to typically inject drugs in a kind of medically supervised way, where they've got access to health professionals, but also housing, employment, social care advice. So they're not a new idea. There's 200 globally, but the UK hasn't had one until January, because a really incredible group of health professionals working with drug users in Glasgow developed the Thistle model, but they did it in a way that was really evidence-based and really worked with all the decision makers to kind of walk them down a path that the drug consumption room seemed like the best response, and they really brought everyone on that journey. So I'm trying to replicate a lot of that in London. I know Cara's trying to do the same in Bristol, that we need to be looking at the ways that we can keep people safe within this model of prohibition, especially with the increasing harms around drugs. So we've created, a network of different councillors from all different parties. So I'm working with the Scottish National Party, the SNP, the councillor who led that in Glasgow. We've got councillors, and so if you know anyone, any elected leader or elected councillor who even quietly talks about drug reform and is supportive of making change, we want to create a space where people can speak about the change they want to make, because we know that this comes from the grassroots and comes from the bottom up, and we know there's loads of councillors who see this harm in their communities. I've also spoken to lots of sympathetic police officers who are the ones that encounter people who are using drugs, who have overdosed, and want to see change. And I think if we create a really strong network of councillors and elected people across the country, we can really start to provide that cover to each other, share best practice, and hopefully see more and more drug consumption rooms being opened, because currently they are technically illegal, although we'd kind of challenge that, because you'd only need a memorandum of understanding from the police. Glasgow were able to open theirs because they got a nod from their Lord Advocate, which is their chief legal person, to say that it's not within the best interest for the police to criminalise people who are using drugs and carrying drugs or being in the drug consumption room. And they've also used that to challenge stop and search, which is incredible, to have a framework that will stop the police being able to stop and search people because it's not within the best interests of their health interests of that individual. So the other way that I work in the Assembly is to challenge the Met Commissioner, so the top person within the Metropolitan Police, which is quite scary sometimes. I'm coming up against a huge status quo of, a history of incarceration of people using drugs, a huge stigmatization of people who use drugs, and just a whole perception that people who use drugs are bad and wrong. The Met Commissioner has even said to me, when I was questioning him recently, some of his language was, we get phone numbers when we arrest addicts, was part of a response when I was trying to ask him about the work that they do around drugs. We know that drug enforcement has completely failed. So Shoba referenced the Dane Carroll Black report back in 2022, which said that we spend 19 billion enforcing drugs, and more than that in the whole system of policing and drug enforcement. And we know that that's completely failed. I obviously referenced increasing drug deaths, linked to increasing toxic supply, the increase of children being exploited through the drug trade. And that's kind of what I try and put to the police. I'm like, and me and Neil talk about this a lot, like, what measures are the police using to judge success in terms of the way that they're policing and enforcing this war on drugs that has obviously failed for the last kind of 50, 60 years. And I think that's what I find really difficult, being able to say, what are you measuring? Because if, surely, the first principle of policing is to preserve life and save life. And I think if more people are dying, then we're failing and we need a different approach. And that is what I try and question the Met Commissioner on. I asked him about the different models. I said, do you think that different models of drug, taking a different approach around legalization? I presented all the different framework, and they're not meant to ask us questions when we question them, but he completely changed his body language, and he looked at me. He was playing up to the Conservative Assembly members, and he just said, "Could I buy crack cocaine at Boots?" And everyone was, it was pretty shocking, but sadly, and I know different people who've had these experiences, I've received a lot of misogyny through my career, so I just kind of reflected it. I just kind of stayed calm and reflected it back. And I said, well, it'd be based on a system of harm, and explained how different drugs would be accessed. But I think that shows what we're up against when you can see what needs to change. But, if that's the frame of reference of the people who are enforcing the laws and making the decisions. And like I said, there's lots of police officers who I meet who have encountered people who've overdosed who want to make a change. So I don't want to kind of say the whole system's broken, but the whole system is broken. But I think that there are people within the system that we need to support and we need to work with to make this change. And talking about that, and in terms of finding allies in strange places, there's a couple of Conservatives on the Assembly who are of the kind of libertarian side of the Conservatives and do support drug checking and other types of drug harm reduction. So I worked with one of the Conservative Assembly members on a budget amendment around drug checking. It wasn't supported by the Labour Assembly members and some of the Conservatives, which was strange, but which is a real shame. But that was all around supporting the loop that Bristol have got in London and expanding drug checking. So I always say that I care about this issue more than my politics, and I'm in this to make change, and I'm happy to work with anyone who's got their heart in the right place and wants to make a difference. Which is the same with this network of counsellors and wanting to work with as many people as possible who think, who can see that our drug laws need changing. And I think we do that by shifting the Overton window and speaking a lot about how there are these different models. And I think our Green Party drug policy does that based on Transform's blueprint, and just being able to say that a different world is possible, but also doing that for harm reduction, because I'm terrified by the number of people who are using drugs in a problematic way that means that they come to huge harms. And I think as the Mayor of London and elected people in London, this is a public health emergency that needs to be spoken about. I'm pushing. Another way that I use my power is to make sure that other people have connections in with the people who make decisions. So I've invited anyone's child to have a platform with the Deputy Mayor of Police and Crime. I've also made sure that people like Release are able to come to the London Drug Forum and talk about kind of housing harm reduction, as well as drug consumption rooms, and just making sure that we are developing as many different ideas as possible. So we also use the budget amendment process to put forward a mobile van idea around a drug consumption room. And Release were incredible at putting forward a kind of itemized a display of what was needed in this in the van, down to like how much an individual needle would cost, and just being able to kind of present that to the Assembly and say that how these things could work in practice is really exciting. And although that wasn't approved, I just think it's great that we've got these things that exist and are real. So I think this is all about working together. It's all about becoming big, as Steve was saying, huge allies of the drug harm reduction movement. but also talking about legalizing and regulating all drugs. I think, the psychedelic movement is a huge part of how we talk about drug use, how we destigmatize all drug use, how we make sure that people aren't coming to harm, and how we make sure that our politicians are held to account to make these choices. There was a drug debate in Westminster Hall recently, attended by a few MPs talking about drug use and how to prevent drug death. Our Green MP, one of our Green MPs were there, as well as MPs from other parties. Unfortunately, the government only responded from a health perspective, which is great in terms of if they want to commit to more money into funding for treatment and other things like that. But if the Home Office aren't looking at this seriously, then that's where we need to be putting pressure on the government. There are moments where I feel a bit helpless in this. I feel like it's huge in terms of trying to influence how we change our laws, but also how we continue to protect people who use drugs problematically to be able to get the help they need. But I think every time we see some small change in Europe, globally, in Scotland, we need to celebrate it and learn from it and bring that to, well, I'm going to say London, but, just make sure that we're making that change as possible in our local communities so as many people as possible can be supported from a different approach. I think that's all I've got to say.